So my name is Marcus Manafo. I'm a professor of biological psychology at the University of Bristol, where I'm also Associate Pro-Vice Chancellor for Research Culture. And since it was founded, I've been a programme lead within the MRC Integrative Epidemiology Unit. So my research is on health behaviours and mental health, with a particular focus on behaviours like smoking, vaping, alcohol consumption. And those are public health concerns that are of a high level of relevance to policymakers. So we have, over the years, developed ways of working that allow us to conduct research that is informed by the needs of policymakers, as well as having one eye on the evolving policy landscape. So that's included, for example, going and having early conversations with colleagues in OHID, for example, what was Public Health England, to understand what the live policy questions are, what questions they need answering to inform the development of policy, to put in front of ministers, for example, and then looked at how we can use the resources that we have within the programme to try to answer some of those questions. And of course, what we have as an advantage as an MRC programme within a unit is the agility to adjust our areas of focus through the lifetime of the award so that we can be answering the questions that are relevant at the time that we go and have those conversations with the policymakers. So one of the best examples, and it was a project led by Jasmine Kuja, who was part of the IEU as well, was around the question of whether or not a ban on flavourings in e-cigarettes would be a net positive for public health. So there are two parts to that equation. One is that flavourings help established smokers to quit by making vaping an attractive alternative, and potentially also through the pairing of those new flavorings with the nicotine that's in e-cigarette aerosol, extinguishing the conditioned associations between cigarette smoke and the reward associated with nicotine. But the flip side is that young people might be drawn into vaping because flavorings make vaping more attractive. So what is the net public health effect of having flavorings versus banning flavorings? If you ban flavorings, you might reduce the number of smokers who quit, but also reduce the number of young people who transition into vaping, who otherwise wouldn't have done. So calculating what the balance of evidence is not straightforward. We developed, in discussion with OHID, the Office for Health Improvements and Disparities, a decision tool that was designed to help policymakers see what the numbers were on the two sides of that equation, if you like, where the numbers could be updated as the evidence evolved and plugged into the tool to effectively filter down to a binary decision that this would be a net positive or a net negative. What we found, based on the evidence to date, is that banning flavorings would be a net negative because the impact on smokers quitting, the negative impact on smokers quitting that you would get from banning flavorings would be greater than the positive impact that you would get from reducing the number of young people who started vaping. That's obviously based on a number of assumptions. As an academic, as a scientist, you would want to get into the weeds of all of those different assumptions and the extent to which they hold up or not. But from a policymaker's perspective, they need to make a decision on a potential policy based on an accessible synthesis of the evidence. And so that was what we provided. It wasn't so much about generating new data, it was about plugging existing numbers into a framework that made the conclusions very clear and made the totality more digestible for those policymakers.